Which of the following symptoms is not a danger sign of pregnancy? A. Fever or chills. B. Persistent vomiting. C. Increased urination. D. Vaginal bleeding. E. Swelling in face or fingers. The answer is C. Increased urination. It is important for the obstetric registered nurse to recognize the following danger signs of pregnancy: profuse vaginal bleeding, severe headaches, visual disturbances, abdominal pain, persistent vomiting, fever, chills, or swelling in the face or fingers. These may be signs of placental abnormalities, hypertensive disorders or pregnancy, maternal infection, or hyperemesis. Increased urination may be concerning to some women, but during pregnancy, the increased mass of the uterus induces pressure upon the bladder. Which of the following tests may be used to assess the risk for neural tube defects in the fetus during pregnancy? A. Alpha fetal protein, AFP, test. B. Ultrasound. C. Non-stress test, NST. D. Chorionic villus sampling, CVS. E. Amniocentesis. The answer is A. Alpha fetal protein, AFP, test. The alpha fetal protein test is the only test that can predict neural tube defects in a fetus during pregnancy. CVS can detect fetal karyotype, sickle cell anemia, phenylketonuria, PKU, Down syndrome, and Duchenne muscular dystrophy. Amniocentesis can detect genetic disorders and lung maturity. Ultrasounds provide images of the fetal position, measurements of the fetus and placenta, and can confirm pregnancy and gestational age. Non-stress tests, NST, are used to record fetal heart rate to assess fetal well-being after 28 weeks gestation. What is the proper management of atypical squamous cells of undetermined significance, ASCUS, or low-grade intraepithelial lesion, LSIL, in women aged 21 to 24? A. Cervical conization. B. LEEP, loop electrosurgical excision procedure. C. Repeat cytology in 1 year. D. Repeat cytology in 6 months. The answer is C. Repeat cytology in 1 year. ASCUS or LSIL in women aged 21-24 should be managed by repeat cytology in 1 year. Neither cervical conization nor LEEP, loop electrosurgical excision procedure, would be appropriate in a patient of this age or presentation. What follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels would be present in a patient with premature ovarian failure? A. FSH greater than 120 micro-international units per ml and LH greater than 80 micro-international units per ml. B. SH greater than 25 micro-international units per ml and LH greater than 40 micro-international units per ml. C. FSH greater than 40 micro-international units per ml and LH greater than 25 micro-international units per ml. D. FSH greater than 80 micro-international units per ml and LH greater than 120 micro-international units per ml. The answer is C. FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters. Premature ovarian failure is the loss of ovarian function in an individual under the age of 40. FSH greater than 40 micro-international units per milliliters and LH greater than 25 micro-international units per milliliters would be indicative of this condition. What are the signs and symptoms of ectopic pregnancy? A. Cramping and abdominal mass. B. Nausea and diplopia. C. Fundal tenderness and vertigo. D. Abdominal pain and vaginal bleeding. The answer is D. Abdominal pain and vaginal bleeding. The most common symptoms of ectopic pregnancy are moderate to severe abdominal pain and vaginal bleeding. Pain may be cramping or sharp. Bleeding can be heavy and the individual can even begin to bleed into their abdominal cavity. Ectopic pregnancy is not consistent with fetal survival and requires treatment with methotrexate or, in the case of bleeding, surgery may be indicated.